Today we are going to learn about the blood supply of abdomen and pelvis. We'll first go with the abdomen. It is supplied by the dorsal aorta, which pierces the diaphragm at the aortic opening at the level of T12, and it further gives different branches. First, we'll discuss the dorsal branches. First one is the celiac trunk, which arises between T12 and L1. It gives left gastric, splenic, and common hepatic, three branches majorly. Then the splenic artery gives short gastric and left gastroepiploic branches, and the common hepatic artery divides into proper hepatic and gastroduodenal artery. The proper hepatic further divides into right and left branches. The right branch gives the cystic artery. The gastroepiploic artery gives the the gastroduodenal artery gives the right gastroepiploic artery, and the proper hepatic artery is the right gastric artery. Now we'll focus on the stomach, how it is supplied by left gastric, which was a direct branch of celiac trunk, by the right lesser curvature is supplied by the right gastric, which is a branch of proper hepatic artery, and then comes the greater curvature, which is supplied by the splenic artery via short gastric and left gastroepiploic, and the right gastroepiploic, which was a branch of gastroduodenal artery. This is all about stomach. Then we can see that the gastroduodenal artery, after giving branch to right gastric, it also divides into two branches. This is the right gastroepiploic and the superior pancreatic or duodenal artery. Now we'll come to next branch. This is the superior mesenteric artery. It is given at the level of L1. How it gives different branches, we can see. First branch it gives is the inferior pancreaticoduodenal. The superior pancreaticoduodenal from the gastroduodenal artery also, and the inferior pancreaticoduodenal from superior mesenteric artery. Anastomosis at the second part of duodenum, and supplies the pancreas and the duodenum. The duodenum is additionally supplied by some arteries. These are the supraduodenal artery, retroduodenal artery, supraduodenal artery from the common hepatic, and retroduodenal artery from the gastroduodenal, and some branches from the right gastric and right gastroepiploic arteries as well. Then we'll go with this is all about duodenum and pancreas. Then next branch is the middle colic. Middle colic divides into ascending and descending branches. The ascending branch anastomoses with the left colic. We'll discuss it later. Then the middle colic descending branch anastomoses with the other branch of superior mesenteric, which is the right colic, and the right colic also gives ascending descending branches. Similarly, then comes the ileocolic, which also gives ascending and descending branches, which anastomoses as shown. Then the ileocolic gives the anterior and posterior cecal and the appendicular arteries, which supplies the cecum, and the appendicular artery gives a recurrent branch which anastomoses with the posterior cecal artery. So this is all about superior mesenteric artery. We have seen it gives the first branches inferior pancreaticoduodenal, middle colic, right colic, ileocolic, and then the appendicular arteries. Okay, then comes the inferior mesenteric artery, which is a branch given at the level of L3 vertebrae, and then it divides into first branch, which it gives is the left colic, which anastomoses with the middle colic. Uh, then it then it gives another branch, which is the sigmoidal artery, which anastomoses with the left colic, and inferiorly it anastomoses with the terminal branch, which of inferior mesenteric, which is superior rectal. Superior rectal also anastomoses with sigmoid, and descendingly it supplies the rectum and anus until the pectinate line. So we came to know about the inferior mesenteric artery, that it has the following branches like left colic, sigmoidal, and the terminal, which is the superior rectal. It is the direct continuation of inferior mesenteric artery. So we have discussed the dorsal branches. This was the celiac trunk between T12 and L1, and a few centimeters below the celiac trunk at the level of L1 there was superior mesenteric, and then at the level of L3 there was inferior mesenteric. Now at the level of L4, aorta will divide into two branches, that is the common iliac branches, and which will further divide into external and internal iliac. We'll discuss them in the pelvic region. Now we'll discuss about these were the terminal branches, and now we'll discuss about the lateral branches. These are the inferior pharyngeal artery first, and the superior suprarenal artery drains into is a branch of inferior pharyngeal artery. Then comes the middle suprarenal, which is direct branch of aorta, and then comes the renal artery. Renal artery and the inferior suprarenal artery, which is a branch of renal artery. You can see the course of renal artery. Renal artery gives two branches, anterior and posterior. Four segmental arteries arise from the anterior branch, and one segmental artery, that is the fifth one, arises from the posterior branch. Then it further divides into lobar, interlobar. This one is the arcuate, and then the interlobular and the efferent arterioles. The rest of that we will discuss in the venous drainage. Till efferent arteriole, it is the arterial supply. Okay. Then comes the gonadal artery, which supplies the ovaries in ovaries, fallopian tubes, part of uterus in females, and it supplies the testis and epididymis in males. Then we have the lumbar arteries, four lumbar arteries that arises respectively at level of L1, L2, L3, and 4. And then there is a median sacral artery. Median sacral artery, basically it supplies the anorectal junction. And now as you can see that the anus is supplied up till the pectinate line, it is supplied by the superior rectal, and below and the median sacral supplies the anorectal junction, and below the pectinate line it is supplied by the inferior rectal, which is a branch of internal perineal. We'll discuss it in the pelvic region. This is all about, and the middle rectal, which supplies the muscular coat of this rectum and anus, okay, which is also a branch of internal iliac artery. So we'll discuss it in the later videos in lumbar region arterial supply. So you can see this is all about the whole arterial supply of abdominal cavity. If you have any question, you can ask.